Good evening, board members. We are live and recording.
Hi, good afternoon. Let me call the meeting to order. First, maybe ask everybody to rise for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Mr. Pratt, will you please certify the agenda?
Good afternoon, Board of Health members. The County Attorney's Office has reviewed all of the items on the agenda and they meet legal approval. There is one item, item 3D, that required notice prior to this hearing, and that notice was accomplished on June 23rd, just for the record.
Okay. Other than that, though, we are good to go?
Yes, Mr. President.
Thank you. So let me ask, has everybody had the opportunity to review the minutes? And are there any changes people would like to recommend to it?
I've read the minutes. I have nothing to change, but did you ask about member disclosures?
Oh, goodness, thank you. I did not, thank you. I jumped ahead. Are there any member disclosures for any agenda items on today's meeting?
I have none.
No, sir.
No, sir.
Great. And I have none either. Now let me move to the approval of the meeting minutes. Has everybody had the opportunity to review the minutes, and are there any revisions? None? Seeing... Oh. No.
Mr. President, if it please the board, I do have a motion to approve the consent agenda, including the minutes from the June 9th meeting as presented.
Second.
We have a motion and a second. All in favor say aye.
Aye.
Opposed? Thank you. Thank you. So I want to, today's meeting seems like the right time to make a few points about our newly developed health department. First, I think it's important to note that it's the vision of the county commissioners that made this possible. They understood that Douglas County has unique public health needs, and because of that, it was important that we develop a county health department designed for the 21st century, and most importantly, designed for the needs of Douglas County residents. The first step was putting together a county board of health, and the second step was hiring an executive director. Both of these tasks were quickly accomplished, and we landed an executive director who understood that what we wanted was an agency focused on the issues the citizens of Douglas County were facing. We wanted an agency that would provide Douglas County with the best information available, but that would allow each of them to make their own decision on how they wanted to evaluate that decision and how they wanted to use it. Douglas County wanted a health department focused on the unique issues of Douglas County. This isn't a veiled criticism of Tri-County. It's a recognition that there is a difference in services needed for each of the three counties that were in Tri-County, and it was time for us to go our way and provide for our own citizenry. We asked our residents what public health issues they wanted a new health department to address, and thousands of them told us that they were most concerned about behavioral health, including substance abuse and mental health. And it's important to note in this area, this is something the county commissioners were well in front of any other county, certainly in the state and perhaps the nation, in addressing. This is an area that, they didn't need a health department to do it. They went out and they addressed it because they understood that this was important to their citizens, and they understood the importance of the issue. And we happened to be lucky enough to land an executive director who understands this issue very well from his past positions, and that is going to seamlessly fit into the work that's already going on in Douglas County. Second, injury prevention. This was a really significant issue for residents when we polled them. There is an amazing number of just accidents and things that they wanted us to see how can we address it. And I know that this is an issue that Director Hill is working on. Finally, disease management and prevention, which is really the core work of a public health department. You know, public health is a lot of things. Public health is community health. It helps people in Dougco lead a healthier life. It's not gotcha. It's not telling people what to do. It's not compelling people to do things. It's providing information to people and letting them make decisions on their own. It helps businesses understand how to do those things safer, and it helps parents and families and everyone else understand, what the risks are, provides them with information, and then armed with that information, people make their own decision. A key area of public health is environmental health, which, most people probably don't recognize in their everyday life, but it's really important. It's inspection of restaurants, it's childcare, it's body art. It's things that help us manage growth in a county, in a county that's growing, that is really important. Septic and sewage, which, is not the most sexy issue to be talking about, but it is really important if you're going to have a county that is going to be growing, and is going to be growing in a manner that is responsible. You need to address those things. So we're designing a health department specifically for the needs of Douglas County. We are, at the direction of the commissioners, going to be providing services and information to the public. We are not going to be heavy-handed, and we're going to let the public know what we know. We're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we think. And then they're going to be able to make decisions on their own. And I just thought we're about halfway through this experiment because come January 1st of 2023, we will be operating a full health department, and I thought it was a good time to give, one, recognition to the commissioners for their vision in setting this up, and two, give the public an idea of what we're doing and how things are going. So with that, I'll ask my colleagues if they have anything else that they would like to add, or we can move into the agenda. Colleagues. Or you can look at me like I spoke way too long, and we can move on.
Well, then let me alleviate the tension, if I may. Well, first and foremost, there were many discussions among the county commissioners of, well, who would we put on this Board of Health? Who would it be composed of? Who would, in essence, lead it? And I've been nothing but proud and nothing but happy with the residents who have chosen to join us on the Board of Health. We've had several momentous decisions that have come before us. We've, of course, in building a brand new organization for the 21st century here in Douglas County, we've probably dealt with many mundane issues. But mundane as they may be, they're, of course, critically important. And whether it was stepping through the community health assessment, coming up with the public health improvement plan, and then, of course, as you said, Mr. President, acquiring what is proving to be an extremely competent public health director. I just can't be more proud. Commissioner Thomas and I have had the opportunity in recent months to visit with our colleagues, fellow commissioners up in Arapahoe County and Adams County, and it didn't feel like we moved at lightning speed. Being a part of this process has felt deliberate. It has felt like many of the projects that I have been involved in professionally, in the military, in elected office, in my 8 years. And yet, you talk to the folks in Adams County and Arapahoe County, we did proceed with lightning speed. So what my vision always was a department that was going to be created for the people of Douglas County, and then a Board of Health of the people of Douglas County. And I think we're hitting the highlights there. I think we're meeting mission on that one. And I think the challenge as we keep going through the process, and we've got some decisions to make today, thanks to our public health director bringing them before us, we need to make sure that we are building a legacy, we are building the traditions on this board so that we never lose sight why we're here. We are here for the people of Douglas County.
Thank you. Thank you, Commissioner Teal.
Can I just make one
Doctor.
brief comment? I have been in medicine for over 30 years, and I've been in private practice. I've been at a university level, including at the University Health Sciences Department, been on innumerable projects and committees. And this has been one of the most collegial, well thought out, and, well done projects I have ever seen. And I am very proud to be a part of it, and I thank you for the opportunity.
There you go.
All right. Sorry about that delay. Just wanted to thank all of the intentional work that's been done, and just to recognize, I would just agree, this piece about mental health and having behavioral health be a core sort of principle that we're pursuing and being deliberate about it is really key to our success, because those are areas that are of big concern within the county. So grateful to all of you.
President Benevento, thank you for your words. It's hard to believe that 2 years ago this month is when the Board of Commissioners in Douglas County decided we were going to create our own Douglas County Board of Health and our own public health department. And here we are. We have said all along that it was going to be a seamless transition. We weren't going to have any gaps in services. And we've worked well with Tri-County as we build our own health department under Mike Hill's leadership. And I think the importance of mental health, I appreciate President Benevento mentioning that. Douglas County launched the first community response team 5 years ago in May of 2017. And we have saved lives. We recognized early on, after a really tragic murder-suicide in Douglas County in January of 2014, that there were opportunities for Douglas County to do things better than were being done anywhere else in the country. And so when the board I was on 2 years ago decided to leave Tri-County Health and start our own health department, having watched how the county built the Douglas County Mental Health Initiative, I knew that we could get this done because the staff here at this county are amazing. And we've added people, we've added Mike to help get us to January 1st of 2023. And we're hoping that you feel us all working with you, and looking forward to more tailor-made public health for Douglas County residents. Thank you, President.
Thank you. And thank you all. And Dr. Fielding, I think you're right. The collegiality on the board is great, and I think that really helps us move forward productively and well. And with all of those kind words, Director Hill, please now give us an update and tell us things are going as well as we just said.
Well, thank you all for those nice words, and I think things are going at least as well as you said, maybe even better, but try not to say that too loudly unless I got wood to knock on. We've done a good job of attracting people to work for us. Partly that's because of Tri-County employees looking for new situations with Tri-County going out of business, but we've gotten applications from all over the country, in fact, all over the world for our various positions. People rightly assume that Douglas County is a great place to want to come and work in. So that's gone smoother than I could have ever hoped. We've taken on the vital records in June, and we're on track to make about $5,000 worth of fees for vital records this month, the way it looks to me right now. We took in almost $3,000 in our first month on the project, so that, as advertised, that should cover its own cost with the fees that it takes in. So no net cost to Douglas County, hopefully, for that program. We took up the emergency preparedness and response and disease controls and surveillance. And John says that's a mouthful, and he is correct. That's a mouthful title, but we took those services on July 1st. We've not had any hiccups so far. Everything is going smoothly. And we had one little hiccup with one of our new employees reaching out to business owners and not prefacing her questions correctly, but we're working on both her approach and doing some damage control with the people who didn't appreciate her approach. But that's a small hiccup in a big operation. Next to come is environmental health, which will take over September 1st. That is actually the largest component of this health department. That division will have 12 people in it, making it the biggest division of the Douglas County Health Department. So it's a major undertaking right now, just getting all the staff in line. Again, we've got plenty of applications, a lot of people to pick from, but getting everybody picked and hired, since we're going to be transitioning into space that Tri-County currently occupies with environmental health, we've had to line up a building over at the fairgrounds to bring these staff on board so we can train them for a few weeks before Tri-County is ready to vacate and we go in and take over services on September 1st. But that's all coming together. The County Facilities Department has been a great partner in finding us a place to be for a short term while we train folks. That's going great. I did complete an application for a WIC program to serve Douglas and Elbert counties, and I got some messages that kind of telegraphed to me that I think we're going to get awarded a WIC program. They haven't said that in so many words, but I have a call with the WIC program at the end of the month to discuss it, and they have to announce their results by the end of the month. So I don't think they're kicking me to the curb, or they wouldn't be inviting me to a meeting 3 or 4 days before the deadline. So I'm feeling good about that. Still working with, not just Tri-County, but the new Adams and Arapahoe County Health Departments, and working with the county attorneys in all 3 counties to come up with, how all the pieces of Tri-County get taken apart and what goes where. So lots of meetings on that subject. And let's see, future things we're working on right now is for the clinical services, the clinical and the health promotion and outreach parts of the operation. We did an RFP. We were not successful with an RFP, but having done the RFP, we were able to reach out to others in the community, and I think we're pretty close to landing a partner for the clinical services to start later in the year. So that's looking okay. They tell me I don't speak loud enough, or I have to get closer to the microphone, so I will try to do that. Let's see, you threw me off my track, Chris. So as of today, we have 13 employees in the health department. By September 1st, we'll have 27 employees. So it's really grown from the 3 of us that started back in the end of February. We're doing a good job. We're advertising this week for a public health nurse that's going to work with staff at Human Services to do home visits. So we've been working with the HR office to get that posted, so I'm optimistic we'll get someone good there. One thing I did want to note that I forgot to put in my report is last meeting we had a question about a water rule for an annual permit review out in the Pinery, and we did research and found out that rule was in the Pinery water and wastewater districts rules. It was not. Is not in our proposed rule, and as far as we can tell, it hasn't been in Tri-County's rule within recent memory. We couldn't find a version that showed it, so we tried to research that. Otherwise, things are going well, and many thanks to the support from all of you.
Excellent, thank you. Are there any questions? So from all of that, I can take it that we are on schedule to meet our December 31st deadline to take on all services, and we will be fully equipped and up and running on January 1.
Yes, sir. Actually, we'll be fully up and running in mid-December because Tri-County needs to wind down their last services by mid-December,
right,
in order to put drugs back where they belong and get people noticed and off the payroll. So we'll be fully operational by mid-December.
Okay. Excellent. Well, as always, as issues arise, I think you have the ears of everybody on the board and the help of everybody on the board. So if something comes up, please let us know. Obviously, this is important. Any other questions or comments from any of the board members? Commissioner Teal.
So for the Public Health Director, questions concerning if we're looking at September to roll out environmental health, I take it that's going to include restaurant inspections.
Correct.
And so, gosh, I mean, I probably want to ask a question that's a really long answer, but it's along the lines of training of the personnel, hiring of the personnel. I guess we do have 2 more months to go, but where do we think we are in the process specifically? And I know this, with everything we've gone through in the last 2 years, restaurant inspections may sound like a minor issue, but this is honestly, Mike, the thing I get asked about more often than not with public health is restaurant inspections, and not just from restaurateurs, but from people, just ordinary people on the street, as it were, asking about it. So we're going to be able to do our own restaurant inspections then in September. That's something that we can share if we're asked about it in the public.
Yes, absolutely. So that the reason for us finding space out at the fairgrounds to do training is we're going to have 3 to 4 weeks of training with these inspectors, because it's not, a lot of them are already inspectors in various health departments, but we're bringing up a whole new software system to do inspections on. So we'll be ready to go. People will be trained. We're not having any trouble hiring. In fact, we're trying to hold back so that we don't hire the people before we have a place for them to sit. So
Okay.
it's going to work. Tri-County, the manager locally has agreed that he'll be out before the end of August so that we can get our people situated and where their seat's going to be, and we'll be ready to do inspections. As I said, many of them are already inspectors, so that part of the training is, maybe training them up in our philosophy of how we want to approach things. But as far as how to technically do an inspection, a lot of them already know that.
Okay. Excellent. Answers my question.
Thank you. Any other? No? Great. Well, thank you. Thank you, Mr. Director Hill. So let's move on to the action items. And what we'll do is we'll talk about them. We'll open it up for public comment after each action item, and then we will vote. Director Hill, would you please go through the IGA, which I think we've discussed already, but please go through again.
Yeah, so the IGA, the main focus of the IGA is to make an agreement with Tri-County for the staging of us taking over services and them releasing services, but even more importantly, us taking on space that they occupy and them moving out of that space so that we have a place for our employees to work. So that's pretty much the nuts and bolts of what's in there, unless Mr. Pratt has more details he'd like to add.
No, that covers the main points. I mean, obviously, the IGA tries to cover every issue that we may need to address as we start to transition services. Tri-County was insistent that we at least address issues that we are not yet ready to fully IGA over, and that's Exhibit B, I think you'll see. And that covers, this is obviously an ongoing process. This will probably not be the last IGA amendment.
Okay. Any questions on the board on this? Let me ask, are there any comments from the public in the room? Do we have any comments online on this item?
Thank you, Mr. President. I have no online comments.
Thank you. Well, I will then, if there's no discussion among the board members, I would seek a motion on this item.
Mr. President, I'll offer a motion to approve the second amendment to the IGA with Tri-County Health Department.
Thank you. Do I have a second?
I'll second that, sir.
We have multiple seconds. All in favor, say aye.
Aye.
Opposed? Thank you. Next, Director Hill, proposed environmental health fees.
Yes, sir. So earlier in the year, I brought the vital records fees to you to approve, and as with them, we're using Tri-County's existing fees. The vital records fees are set by the state. We can't really change them, but these fees, there are some that we can change. But the way you would change them would be to analyze your costs over the previous year of providing the services. And since we don't have a year's history of providing them, I thought that the soundest method was to just adopt the current Tri-County fee schedule with the promise that we'll reevaluate them next year.
And that makes sense. So what you're doing is and that was really a question in my mind, you're setting the baseline of really costs and expenses, and then we will adjust one or the other as necessary in order to ensure that we're not underfunding or frankly overfunding the program. It needs to be run basically cost neutral. Is that the plan?
Yeah, the plan is to try and run it cost neutral. I'm not sure it can be 100% cost
Right.
neutral, but we'll
Right.
get close. And we will try to, if fees are too high, given our costs, we'll reduce them. So some things might go up, some might go down, some might stay the same, but it'll be based on our tracking our cost and actually providing those services.
Have there, we'll take public comment here, but have you received, and have restaurant owners, have any proprietors come to you or talk to you about fees and their just going back to my days at the state, there was always a lot of people who had opinions about fees and whether they're too high or too low or how they were designed. Have you received any feedback?
I've received feedback on other issues, but I haven't received any comments on the fees so far.
Okay. Any other questions? Comments?
I'll go ahead and make a comment in that I think this is a wise approach. I mean, the reality is, I'm sure we could try to do some kind of analysis and war game this out to figure out optimal fees, but we do need to remember we're getting something up and running that we haven't done here before. And so, no, I think this is a wise approach. We take the fees that were being used by Tri-County, make them our own, and then, probably, I don't know, does the public health director have an idea when we may review these and move them up, move them down?
So my thought is to examine them next fall, like September, October, when we've had a year of experience, and adjust the fees for going into effect January 1 of '24.
Well, again, I think this is a wise course of action and reflects, as I said in my prior comments, the very deliberative process that we have followed. That's deliberate. We are taking our time, but moving forward, we are.
I'll just mention that I did print off the list of the fees because I was interested in what they would look like. And the most expensive one is if you're building a home and you need to put in a septic system, it's $1,120, which at first seems like a lot of money. But when I really thought through and I had read through the packet about everything that goes into an off-site wastewater treatment center, a septic system, I thought, you know what, we have to inspect that. We need to make sure we're doing this right. This is public health. And I've looked through the rest of these, and I think that the fees appear to be reasonable, but I'm not the one paying them either, so thank you.
And I assume, or Dr. Fielding, or did you have any? No. Okay. I assume as we move forward on this, people will come to us. We'll learn things. We'll learn. We'll learn whether we're collecting too much or collecting too little, and we'll also learn whether folks believe they're getting the value for the service that they're paying for. I mean, this really is providing a service to them. So ultimately, if people don't believe that they're getting the value for that service, they have us to come to and say, hey, let's. You guys need to do something. You need to provide better service or cut your fees. So, and I assume we would be open to all of those comments.
Oh, absolutely. I take in all kinds of comments.
Well, great. Well, thank you all. First, next, are there any public comment in the audience on this matter? Is there any public comment online?
Thank you, Mr. President. I have no online comment.
Thank you. I would seek a motion to approve the proposed environmental health fees.
Well, Mr. President, please the board. I do have a motion to approve the proposed environmental health fees as presented in our packet and discussed.
Thank you.
And I will second.
Thank you. We have a motion. We have a second. All in favor say aye.
Aye.
Opposed? Thank you. Let us move on to our next item. Director Hill, public comment with respect to proposed regulation on on-site wastewater treatment system.
Yes, so in order to enforce regulations September 1st, we need to have our own regulations to enforce because the Tri-County one specifies Tri-County. So what we did is we started with Tri-County's regulation. We found a few things that were out of date or in error, but for the most part, it's the same as Tri-County's. Again, as a baseline, we can always look at this next year if there are questions, comments, suggestions about the rule. We can change it, but we decided the most significant thing it does is it contains a clause I put in to repeal Tri-County's regulation within the boundaries of Douglas County and replace it with this regulation. So there's no significant change to the contractors, consumers, homeowners. It's the same rule basically, just cleaned up a little.
Dr. Fielding.
I'd appreciate one clarification, though, because it was my understanding that Tri-County had asked the individual wastewater treatment facilities, the various little subdivisions in Douglas County, to adopt their regs into their constitutions, and then usually would have things such as where I'm at, Pinery Water, to do the enforcement. But if we've made some changes, are we going to request those individual entities in Douglas County to amend or update so we're consistent across the board?
Well, yes, we will. And the changes are mostly in the form of like correct citations of state statutes that might have changed over time. There's no substantive change other than it's us instead of Tri-County at this point.
Yeah, I just want to make sure that it's consistent for everybody. Thank you very much, sir.
Are there state requirements that need to be followed on this? Is there
we had to provide it to them a month ago. Then within 5 days, I believe, assuming you approve it tonight, within 5 days, we have to send it to them again. They've already approved it, so we assume they're going to approve it again. And it has to be, the reason for it being on this agenda is it has to be approved 45 days before we put it into effect. So we couldn't do it in August. It had to be on a July meeting to meet that legal timeline.
Right. Okay. I just know this is an area that can be fraught at times, and and to your point, I won't go into detail, but I was consulted by somebody that was having some issues on this, and it can be very expensive for people, and it can be very administratively difficult sometimes. So, but I think we put this out for comment. I think that we would be open to comment if people find it to be burdensome or otherwise. And certainly this is a very important area because the impact on water quality from multiple on-site wastewater systems is very significant. It really makes a difference in the quality of water, and it impacts the treatment facilities downstream and what the operation and maintenance costs that they have, and certainly it can impact wildlife and have other impacts. So this is an area where look. It's not something people think about every day, but it is extraordinarily important. And so it's something that I think, we should continue to assess to make sure, one, we're meeting our environmental requirements, but two, we're doing so in a manner that is as cost efficient and for people and administratively efficient as possible. So with that, I will again seek public comment from the audience. If you would please give your name and the town that you live in, I would appreciate it.
John Fielding, Pinery. I have some questions for the board and for the executive director regarding things that I found, at least on a first scan of these regulations, to be unclear. The first is, at what point do you think that our current crop of licensed septic cleaners will be licensed by Douglas County? Presumably these people are already licensed by Tri-County. Are these people going to be grandfathered in? Is the work that they're going to be doing between now and September or October going to be accepted by this board? Are homeowners who have septic service done going to have it done twice in order to satisfy this board because it wasn't done by a cleaner that this board recognizes? I think that's one question that should be addressed, is the timetable for licensing the current septic service companies that are in business in Douglas County. Second, it appears to me, at least on a first glance, that homeowners are supposed to have a septic certificate before they operate a septic service. I know in my area, since we bought our house before Tri-County had its regulations, we never got a septic certificate, to my knowledge, at closing. Does that mean that we now have to come before this board and have the Douglas County people inspect our septic systems? And I also note that a septic certificate is required if you sell your property. So at what point is this health department going to be able to handle the requests from property owners who are looking to make a sale but need a piece of paperwork in order to close? I think that those are all issues that this board should consider, and frankly they're issues that I found unclear, at least skimming or glancing at the regulations. Thank you.
We will, let's move to any other comment, and then Director Hill, if you want to address those at the end of public comment, we can do that. Are there any comments online? Oh, I'm sorry, ma'am. I apologize. If you just name and the town that you live in, please.
Okay, Allison Compton in Franktown. And I have the same questions. I just have been dealing with Mike Weekly and Michael Voorhees through a septic system dispute, and the people that come and inspect the septic systems. I got failed on a perfectly perfect system, called and had a second opinion, and then I had a dispute, and I don't have anybody, excuse me, I don't have anybody, or Mike Weekly was the only person of contact that would help me with the dispute. Sent me back to the website to get the inspector to have a second opinion on my tank, and there wasn't anybody that would do it. They said everybody's in the field together. I was denied 3 times, so I ended up having to tell a little fib so that I could get a second opinion and just tell them it was simply an inspection. I guess from what Mr. Voorhees and Mr. Weekly are saying is that there isn't anything or any committee in place to help the consumer with any kind of dispute on the report. And we are selling our home, and I don't have a certificate. I didn't know that was needed. Neither one of the realtors have told me I needed it. So I feel like I'm in a consumer situation where there isn't any help. There isn't anybody to help me. I've paid $1,000. I've had 2 inspections done. One was flagged. The other ones came back perfectly fine. And yet these 2 men have kind of been tossing me back and forth going, I don't know what to tell you. And so I said, when is the board meeting? So I'm wondering if that going forward, if there is going to be a committee put in place, and is there going to be, a black and white rule book where we can go forward, and I quit spending all this money trying to get the right consensus on a tank because they are miles apart. So.
Thank you. Thank you. And if you'd stay after the meeting too, perhaps we could talk too. But thank you for your comment.
Okay, thank you.
I appreciate it. And then let me, is there any other comment in the room? Is there any other comment online?
Yes, thank you, Mr. President. I have Lori who would like to speak. Lori, you're unmuted. Go ahead.
Thank you.
I just got word that Douglas County Board of Health is calling healthcare workers to ask them about how many patients and employees they have in order to prepare pods for a mass vaccination or evacuation. Is there something we should know?
So let me do this. Since we're talking about septic systems at this particular point, we'll get to citizen comments at the end. If you would, if maybe we'll during citizen comments, if you want to bring that up and provide any more detail, we would appreciate it, and then we would be in a better position to address it. But let us address septic systems right now. Is there any? Ms. Dunning, is there any other questions on septic systems?
I have no other online comment regarding septic.
Okay. So there's a couple of issues out there. I think one was a sort of general explanation of the regs and how the transition is going to go. And then I think there was an issue with respect to, you feel caught in between, basically inspections and inspectors. And I guess, Director Hill, is there any insight you could provide to Mr. Fielding, and maybe that needs to be followed up? And then I think this may require actually a follow-up and a discussion, because I sympathize. I haven't sold a house in a while, but when you're selling a house, the last thing you want to worry about is something like this. So I think we need to provide you with some direction. If you could, one, provide some guidance, and then perhaps talk to this woman afterwards about how we can help her, bridge the gap that she's seeing.
Okay, and hopefully I captured all the points here. So the first was a question about the permits for the contractors and the pumpers. They all have permits that go through the end of the year, and they'll all have to buy new permits from us in January. Same thing with all of the environmental health programs. Their existing permits are honored through the end of the year. If somebody new comes into business, they'll have to buy a permit from us after September 1st, but otherwise they're good until January 1st when they renew. As far as the certificate that you get when you sell your house, that's been in effect for several years, and maybe Caitlin can tell me the exact year that went into effect, but that's not a new thing. It may be not well known by all the homeowners. The realtors certainly should know about it. It's been going on for a while, and it was a topic of some controversy when Tri-County put that in. So that shouldn't be an unknown thing. And as far as, having to redo work, so again, any permits that have been issued by Tri-County they're honored by us until they have to be renewed, or like the septic permits normally aren't a renewal thing, but permits are just going to continue. We're not cutting people off. And then there is an appeal mechanism. So if you have a problem with an inspector, you would appeal that to their supervisor, and then to Caitlin, the Assistant Director for Environmental Health, and then ultimately to me.
Right. Okay, so I think we touched upon the general issues. I do think on the specific issue, if you would maybe talk to this woman who's trying to sell her houses, so she can know how to move forward in doing that, and if there's certificates she needs to get, then how would she obtain that so she could sell her house in a timely manner, and if there's a dispute process, maybe go through that a little bit. But it sounds like she's at the point where she's at the top of the dispute process. So,
but the issue is that until September 1st, the process is
it's Tri-County,
Greenwood Village. It's not here.
Right. Okay.
Board, may I just speak up for a second?
Oh, yes, please.
Assistant Director. So the use permit did start in 2011, and that is the process that you go through to essentially get an inspection done on your septic system like you would your house. It's like a home inspection before you sell it. It sounds like the community member who is having the dispute with the tank has already begun that process, and that's likely why she had the septic tank inspected in the first place. So I think she's on the right path. It does sound like there's some dispute that would be ideal to talk through how we would handle those in the future.
Okay.
And then as far as the certificate before operating, we do go out and inspect the system to ensure it is installed appropriately. And then we issue that permit, and it's called a use permit, before they cover it up and then start using it. So Mr. Fielding's house was probably appropriately permitted when he bought it. So he does not need to have somebody come out and inspect it again. If he were to sell that property, then he would have a use permit inspection done. So that's again where they go out and do an inspection like you would before you sell your house, just on your septic system. So we will begin handling those September 1st. We will have inspectors in place that can review those inspections, ensure they're completed appropriately, and issue those permits again starting September 1st.
Okay. Right. Okay, so it sounds like, okay, the initial permit is just to ensure that's installed properly, and then you make a one-time determination on that. And then there's another inspection upon selling, basically to make sure that the purchaser is getting a septic system that is that is operating properly. So it sounds like this is still Tri-Counties area for now, but perhaps we could provide some direction to her about who to call Tri-County, how this should be worked out, and maybe even help her out, getting, if she's not getting responses, help her get a response. So we're, so she can, complete the transaction that she wants to complete. Are there any other? Is that helpful? Yes. Thank you, sir. Okay, good. Well, and working government's tough sometimes, so we'll make sure that you get names and numbers, and you have people that will return your call.
With all due respect, they didn't answer my question, which is what happens if you bought your home before there was a permit requirement? Are you grandfathered in, or do you have to arrange for an inspection in order to have a permit while you're occupying that home?
Okay, so wait, let me do this. Let me suggest that let me have Mr. Hill address it, and then we're going to move on from this.
So yeah, since your house was built, what, 20 years ago, you said, 25? Yeah, so you don't need another permit. The only time you'd have to do anything is if you get ready to sell it, you'll need to get that inspection so that the new homeowner would know that it's a working system.
Again, like I said, it's a one-time inspection upon building to ensure that the work was done well, and then you don't need to ever show that permit to anyone. And then upon selling, you just need to certify via inspection that it has been that it's still in operating order.
Correct. I mean, the only other time would be if your system goes bad and you need to have it rebuilt, then you'd need a permit for that.
Modification.
Yeah, right.
Okay, thank you. So are there, I think we've had, I think we've taken all comment. There is no other comment online, Ms. Dunning?
Thank you, Mr. President. Not on this topic.
Thank you. In which case, I would seek a motion to approve the approval of the Douglas County Health Department proposed regulations regarding on-site wastewater treatment systems.
Mr. President, please of the board, I do have a motion to approve the Douglas County Health Department proposed regulation 22-01 regarding on-site wastewater treatment systems.
Is there a second?
I will second it, sir.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Thank you. Finally, our last action item. Well, no, it's a public comment regarding body art establishments. Mr. Hill.
So this is very similar to the last item in that we're adopting the body art establishment regulation from Tri-County, again with just some cleanup and a repealer in there that repeals the Tri-County regulation and says that this one replaces it, just to allow us to be enforcing things as September 1st.
How many body art establishments do we have in the county?
Caitlin, do you have that?
Yes, there are 13 in the county.
13? Okay.
Yes.
Are there any questions from any of the board members?
I have done.
Commissioner Teal?
Yeah, just, going through it, obviously, I'm no expert in this area, so I definitely appreciate when we do have experts. But do we have any substantial change from the prior regulation with Tri-County?
No, there's no substantive change. And again, this rule is mainly intended to make sure that, tattoo artists are operating in a clean environment and no one's getting diseases from it. That's the bottom line of what it's trying to say.
Any other comments? Let's go to public comment. Is there anybody in the room that would like to comment on body art regulations? Is there any comment online?
I have no online comment.
Any final comment, Director?
No, again, it's not a change to the operators. It's the same regulation, just cleaned up.
Right. I would accept a motion to approve proposed regulations 22-02 regarding body art establishments.
Mr. President, I have a motion to approve the Douglas County Health Department proposed Regulation 22-02 regarding body art establishments.
Do I have a second?
I will second.
Thank you. All in favor, say aye.
Aye.
Opposed? Oh, and we didn't take public, we didn't have any public comment on this. Okay, thank you. So that is our agenda, but now let us move on to citizen comments just on general topics. First, let me start in the room and see if anybody has any comments generally for the board. No? Let me go online. I think there was someone that did have a comment on that we should go back to. Ms. Dunning, are there comments? And perhaps we can go back to the woman who had a comment regarding some public health services.
Thank you, Mr. President. Yes, I still have Lori. I'm going to go ahead
Okay.
and unmute her so she can repeat her comment. Go ahead, Lori.
Oh, and if you would just give us you've given us your name, and if you would give us the town that you live in, I would appreciate it.
Lori Barbieri, I'm in Douglas County. So I have heard some healthcare workers recently saying, private healthcare workers saying they've been called by the Board of Health, Douglas County representing the Colorado Board of Health, asking them how many patients and employees they have in order to prepare pods for mass vaccinations or evacuations. And I'm just wondering if that is standard procedure or if there's something we need to know about.
Thank you. Ms. Dunning, is there any other comment? Are there any other comments?
I have no further comments.
Okay. Director Hill, let me turn it to you. I'm unaware of any requests like that went out from the Board of Health, but let me turn it to you.
Okay, so, and I have heard of this issue already. So this is an annual update to the information. So we have information on all the healthcare providers, on how many staff and patients they have in case there was some kind of public health event a la COVID-19, so we would know how many people we need to be prepared to take care of. So we have a new employee who has maybe not done the smoothest job of approaching those phone calls, which we are correcting, but it's an annual update that the state requires us to do.
Is this an update to the emergency preparedness plan?
Correct.
So, okay. So because I recall doing something similar at the state health department, where you would want to know how to distribute vaccine. Whether at the time we were worried about smallpox, we were more worried about, but I could see it would be anything else. So it's not it's not a foreshadowing of anything. It is a annual event that occurs.
It's part of our preparedness plan to be prepared for anything that might happen. And it's required, the state requires us to refresh our information regularly to make sure we still know what healthcare providers are around and what their volume of staff and patients is, so we are properly prepared.
And I assume this is a federal, I think this is in fact a federal requirement
It
as well.
trickles down from
Yeah.
CDC to the state to
Yeah.
us. Yeah.
And to your point, I think about the sort of lead into this, that perhaps a script development for something like this would be appropriate so that, people know why they're being asked. And because I can see how people would get like, wait, what? So
Yeah, correct. This is what I'm doing, this is why I'm doing it, now can I ask you these questions? This should be the way it's handled, but
Right.
It's a newer employee, new to employment, not just new to us.
I totally understand that, and it's somebody was doing their job, and so I think to the caller's point, I think which is a good one. If we would work on developing a script, and so that people are very clear that this is procedure, not like out of the blue, or perhaps we know something other people don't know. So
Absolutely. We have been on this since this morning when it first got referred to me.
thank you. I appreciate that. Any other comments from board members? Questions? I trust that answered the commenter's concern and question. Are there any other? Oh, Commissioner Thomas.
Yeah, I just want to say, I know the woman who spoke and had sent me an email earlier, and so I've communicated back with her to let me know if she doesn't understand the answer, and if she doesn't understand it, I will put her in communication with Mr. Hill, but I did send him her email as well.
Well, wonderful. Any other comments?
Well, Mr.
Commissioner
President,
Till.
if it's okay to transition to kind of a work scheduling matter. So if it pleases the board, I guess we have on our calendars a work session for July 22nd. I guess Commissioner Thomas and I are going to be attending the National Association of Counties, which is locally here. But I wonder if it would be something the board would entertain, of course, with feedback from the public health director, to either move that or perhaps cancel it. And I figure the best way to handle that is probably to ask the public health director, do you need us for that work session, sir? Or do you got a hot topic that we do need to look at, kind of moving that around?
Well, I can give you speedy service on this one. Just before this meeting, I directed that be canceled because I don't have enough to bring you together for a work session.
Hey, I love it when a plan comes together.
And he was honest enough not to blame it on you.
Because, well, why should he be any different? No sweat.
Great. Okay, and that's an important scheduling item, so everybody got that we will not be meeting a week from tomorrow for our work session. Wonderful. With that, I would, if there are no other comments or questions, I would seek a motion to adjourn.
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Opposed? Thank you all.
Cool. Kim, I've been meaning to give you.